Good morning, everyone, and welcome to this morning's Family and Children's Services Overview and Scrutiny Committee on Thursday, the 6th of November 2025. I'll start the meeting today with asking for apologies for absence.
Yes, Chair, we've got apologies from Councillors Fairless, Aiken and Jones, and also Reverend Lennox and J. Lewis.
Okay. Any notification from the floor? I'm not seeing any. Okay. We then move on to pages 9 to 12, which is for the accuracy of the minutes from the previous meeting held in September. So I'm not seeing any indication that anyone's got any query over their accuracy. So with your permission, I'll sign those off as an accurate record of the meeting. Again, standard process for the agenda this morning, which is disclosure of members' interests. We all have our disclosures online. But if there's anything on this morning's agenda which you think you have a personal or prejudicial interest in, if you let me know now, and I'm not seeing anything, so that's good. We can make progress. We now move on to the first item, the first substantive item this morning, which is our SEND strategy, special education needs. Now, that's on pages 13 to 26 of your report. But what we have got is we've got a presentation. But before we start that presentation, I'd like to bring in Audrey Kingham, our Executive Director, who will introduce this, and then we'll be handing over to David Street. So Audrey, if I can hand over to you first, please.
Thank you, Chair. Morning, everybody. Good to see everybody today. The Northumberland Area Strategic SEND Strategy is what David will talk to you about. This is the next phase, so we've been through a number of SEND strategies over the years, and they have a life cycle. We came to the end of our last strategy at the end of 2024, and David will talk you through the process and how we've arrived at the key priorities that we're going to work on as a partnership area moving forward. And the important thing here is this isn't owned by NCC. It is owned by all of the strategic partners in Northumberland, which includes all of our health partners, our care teams and our education teams, not just here but in schools, settings and our wider voluntary and community sector as well. So really important that it is collaborative and it is collective in terms of the work that we do together. And David will take you through how we've got to the key priorities, what has occurred to get us to that. It is quite a task to be able to go out to everybody, get all of their views and ideas, their thoughts, review where we were in our last strategy, because we don't leave that behind and close the door. We look at worked well, what we need to step on and do more of from that strategy, and then take it forward and ensure that that's inclusive of the approach moving forward. And David will talk to you a little around the governance and the changes that we've made around that to be cleaner, clearer and sharper in terms of that accountability across all partners. So I'll hand over to David.
Thank you, Audrey. I'll just whiz us through these slides and hopefully there will be lots of questions for later as well, which I look forward to trying to answer for you. So this is the Northumberland Local Area SEND Partnership Strategy for 25 to 28. Audrey's introduced it well really in terms of this is an ongoing developmental piece of work involving all partners. If I can get my clicker to work, that will be useful.
Go down.
It's dead. Oh no, it's come alive. Bingo, that was lucky. Right, brilliant. So the background to this development is that there is a shared statutory responsibility for SEND learners aged 0 to 25, and that's shared between education, health and social care. And that makes the hub, if you like, of this SEND system for Northumberland. Education, social care and health must work closely with learners and families to develop and deliver the SEND system. This isn't about the institutions deciding what's right. This is about the professionals who are delivering on a daily basis, working with families, listening to the residents, speaking with learners and following that feedback then developing the next steps to take the system forwards. The SEND partnership is inspected by Ofsted and CQC. We are absolutely in the window for that inspection, but I will note none of this strategy is developed or designed around the inspection system. It's designed around the developments and the needs of learners with special educational needs in Northumberland. The new SEND strategy has been co-produced between all partners between last April and September now, and I'll give a little bit more detail on the processes that are taking place to ensure that we do hear the voice of everybody in the development of this strategy. And it was ratified by the SEND Partnership Board. Now, the SEND Partnership Board is a board that has been in existence through the previous strategy, so at least 4 or 5 years. And that SEND board has taken us to a point in time, but that SEND board themselves recognise the need for further development and further actions, and you'll see now how that partnership board fits in with some other boards which again are maybe designed to do a little bit more of the holding to account, which is what all partners actually are seeking, is the direction and also the opportunity to either demonstrate where it's going well or also the opportunity to be transparent about where things are not working well. The process since last March is initially it was kicked off with that SEND Partnership Board and had a face-to-face workshop. That board, again, as I say, I'll probably be saying this a lot, involves professionals from education, social care, health, but also the key members of that board have always been the Parent Carer Forum. And there were also a range of other professionals who attended that workshop. The basis of the workshop was to look at what we already knew, or we thought we knew, and then try to pull together what we know about where we were and what steps we need to take to move forward with that. So there were 3 key documents that I suppose underpinned the discussion and the work at that workshop. So one of them was the SEND self-evaluation. We have a document which evaluates the progress of the SEND system. That was completed it was the March 25 version that we looked at that particular meeting. We looked at parental survey outcomes. So last autumn term, it was completed by January. We had quite a wide-ranging questionnaire that went out to all SEND parents and families who are associated with that. So we had the outcomes from their views. We had a joint strategic needs assessment, which in layman's terms is basically a large data document which measures every possible metric we can think of across education, health and social care with a SEND perspective to it. And we worked together, put the findings from those 3 documents together and identified quite a long list actually of areas for improvement. There was quite a lot of high aspirations at that meeting about where the future should take us and can take us. Once those areas for improvement, those AFIs were identified from that group, there was then quite an extensive process of reaching out to other partners. So we took the AFIs to a whole host of different head teacher groups, SENCOs, education, social care and the health workforce. So obviously these are the guys that are delivering on a daily basis. We needed to reassure ourselves that the AFIs we'd identified were ones that they would identify as well. Quite a lot of redrafting, reshifting, some really positive input actually to make that initial list of AFIs more relevant and more appropriate. We obviously was vital to get the views of learners. So it's actually a team within social care, really fantastic team. Our participation team went out and did a series of workshops with learners across the county and again shared those AFIs and had the conversations about this is the way we're thinking of going. Is this the right way to go? And young people saying, yeah, I see that one, I understand that one. You're on the wrong track there, mate. That's not for you. It's not for us. It won't impact on us. And again, lots of adjustment following participation team workshops with young people. Brought all those findings back to the SEND Partnership Board. Reshared a reformed strategy with those partners we'd already discussed with, because the people we talked with first was actually quite different. version to the ones after we'd been through all these series of things. Went back to everybody again, little bit of more gentle feedback at that point, a few tweaks. It was ratified with the board, and then this today is another step in the development process, in that we're sharing that strategy with any and every governance route, and it's not just taking place with NCC. This is being shared with our colleagues through the health governance routes, and and different care strategies as well, to just continue to seek that feedback that we're heading in the right direction, and we are now in the process of putting together a formal launch. One of the threads that comes through from all the work we've done since April and work previous to that, those documents I mentioned, one of the bits that's coming through clearly is about how we communicate what's happening. Obviously, the most important thing is the individual's lived experience, you know, how it's impacting on them as a learner or them as a family. But actually, there was quite a few times in these discussions where either talking with young people or head teachers sometimes, or families themselves who said, "Oh, I didn't know that was happening. Well, I didn't know you were doing that as well." And I think that's important. We need to know where it's not happening. Absolutely, that's the most important thing, and make it happen. But actually, I think we've all got a job collectively, and the launch will continue with that work, but to try and communicate exactly where we are so that there's a transparency across that system. To paraphrase, and you've got copies of the strategy yourselves, but there are 4 key priorities came out. These are quite high level. Each of these priorities will have an action plan behind it about how education, health and social care and other partners are going to work together to deliver what the strategy aspires to. The first one, strong leadership and clear systems, is about governance. It's about knowing ourselves well. It's about holding different parts of the system to account if needed. It is about monitoring and looking at some key metrics and making sure that things are being delivered. And it's about responding to parental views. So there's quite a coverall really in the strong leadership and clear systems priority. Second priority, I'm giving them numbers, but they're not, one is no more important than another, by the way. It just happens. Maybe bullet points would be better than. But the second priority is putting children and young people first. And this is all about participation. This is about engaging with young people, about the impact of the system on themselves, about their aspirations and about whether their aspirations are able to be met within the system that we've currently got, and obviously if not, how the system can change. Families right alongside the young people as well. And I think one of the key elements of this is talking from previous strategy, we've always sought the views of parents, carers and young people. But actually this is not just seeking those views, but there's also some wording within the strategy which is talking about and then going the next step and demonstrating the impact and the changes we have made in response to the views of those families and those young people. And I think maybe that's been a gap in the past, little personal view there, but the strategy is set to work strongly in that area. Getting the right help at the right time is about service delivery. At its core, it is about waiting times. It is about when a family or a young person or a school or any part of the system actually reaches out to work with fellow professionals, are those fellow professionals available in a reasonable timescale? And once those meetings take place, does that go on to have a clear impact on the young person, and does it recognise their needs and support the development and the meeting of those needs? So really all about service delivery right across the system there. And the fourth one there, making sure children and young people with SEND have their needs met as close to home as possible is two-sided at a high level. One side is about inclusion within the current school and early years settings and college system. This is all education 0 to 25. It's not just about one particular sector of it. But it's about the graduated approach. It's about training for staff working with young people. It's about making sure that the local school has the resources, the skills and the capacity to meet the needs of its local residents. And then there's another part to it, which is about where those needs maybe are specialist and where those needs need that additional provision which might not be as readily available in the immediate local school, that we actually have facilities that are, almost as close to home. With one of the challenges of a large geographical area to Northumberland are the resources available close enough? And obviously nobody wants to see large journey times. The solution to that is to make all of our educational settings incredibly inclusive. That's easier to say than do, but that's an obvious. But also where that specialist need, that we actually analyse that and use our place planning strategy to make sure we do have needs met as close to home as possible for all learners. Just a little view of the new governance system and how those 4 priorities are going to be monitored and as I say, each and every single one of us held to account for the progress against them. You'll see, as mentioned before, the SEND Strategic Partnership Board, that's been in existence for a long time and has overseen this development. But actually one of the things that they've requested, interestingly enough, is an executive strategy group to sit on this diagram above them, but to hold that board itself to account that it is making the progress that it should be making. And as a result, this new group, the SEND Executive Strategic Partnership Group, is overseeing priority 1, that strong leadership, clear systems for SEND. And then the board itself will look after the 3 or oversee the governance step for the other 3 priorities, putting children and young people first, getting the right help at the right time, and making sure children and young people have their needs met as close to home as possible. There are already the formulations of groups to oversee those priorities, and actually that will go further in terms of working with different officers and pulling together work streams that are in many cases already in place, but this is the governance system which will ensure that those work streams get completed, and if they're not completed in a timely manner, that we work out why that's happened and put in corrections against that. Just a quick list, a number of times that new governance system will be meeting, and I think the other point for this slide really is just to point out that what we started with, what Audrey started with, that this is a joint SEND system which is a partnership between education, health, social care and all other parties. And one reflection of that is that the priorities themselves, the chairs will, that for the overall group, the executive group, the chair will rotate annually between the partners, but actually the priorities sitting below that will have one which is care-led. It'll have all sectors represented in that working group, but we'll have a care-led one, a health-led one, an education-led one, just again to re-emphasise that partnership working. I've just got one. We're only 2 recommendations in the actual report itself, and I commend these to the floor for comment, discussion and questions.
Thank you, David. So I'm going to open this to questions. So Mr. Hodgson, and then I've got Georgina. Yeah.
Thanks, David. I was going to say that the document, as you say, it summarises the aims, aspirations, priorities of Northumberland. And I think, when you read through, a bit like motherhood and adult parent, I don't think you can disagree with anything that's in there. I think obviously it sets out quite clearly, what you're striving to achieve. But can I just ask you to drill down a little bit in some of the statistics? For example, I've got 4 points. 28% of EHCPs are with autism. Now, autism's on a continuum. You've got your higher functioning end with, say, Asperger's, and you've got, obviously, the other end where non-verbal and so on. How does that actually break down? Because that's a very, very large group in terms of the term autism. And within schools, and obviously support for that range there is going to be very, very expensive. So how does it actually break down? Because obviously the higher functioning end will need less support than those at the other specialist end. That's one point. Isn't it?
Okay.
Okay.
Would you like me to, I can respond to that one in turn, or
Well, I'll give you the whole lot if you want, and then come back. The second one is, and the social, emotional, and mental health aspects. Now that was 27%. Again, out of the three, what's the sort of breakdown for mental health? And the other issue within that is the age range within that. And I know you're going right up to 25, but how does that impact in terms of the school age? Because you're giving these EHCPs under that banner, how many of them are actually specifically for mental health? And the worry about mental health aspect, and I know I'm going back a little bit in history when I was involved, but the amount of support that was available for students with mental health was really stretched under the old CAMS situation there. It was really stretched. I mean, sometimes it would be an 18-month, 2-year waiting list. Has that changed? Because obviously, given this percentage of students that are coming under the AHCP for mental health, what is the support? And is it, in your opinion, sufficient? The other thing is that if a student is on an EHCP, historically, are they on that for their school life? In other words, are we basically saying that this is just going to grow like Topsy? Because, or have you got data which says that the strategies we've got in place for these students is actually working, and we're able to remove them from EHCPs because of what we've been able to put in the early years, saying by the time they got to secondary school they didn't need it? Or are we saying that basically EHCP is for your school life, and therefore that's just going to grow and grow? And the final point is the costing. If you're talking about EHCPs, what's the costing? In other words, do schools have to bridge a financial gap? And if those numbers are increasing, is that in turn putting inordinate pressure on school budgets? So that's the package.
So nothing like starting off with a simple question. David.
Okay, I'll do my best. You're absolutely right to recognise the growth in autism, or could we say the growth in identification of young people and adults, actually, with autistic traits. And I think there's a balance. My gut feeling is there's a balance in the two, that there's generally growth, but actually also there's a greater awareness. So our identification processes are better at a very right from the educational professional starting off right through to an educational psychologist actually making some decisions and writing reports for a particular young person. And I'll add in actually the growth in SEMH learners is the two trends that we're seeing across Northumberland and we're seeing nationally. Those are listed, and the figures that you've looked at, I think you were saying about what's the range within each of those. The figures that are pulled out these are listed as the primary need in the EHC plan itself. Now, there are often secondary and tertiary needs highlighted in the plan. And what we're I suppose, in saying that, and that's why it is an individual education, health and care plan, is the fact that the plan, though it might start and have a primary need identified early doors, it's also a lengthy document which identifies a whole range of needs and the strategies that the educational professional or healthcare professional or whatever should be using to support that young person going forwards. So we're certainly not in a position where we are identifying what the primary needs are with a global view to ensure we have the right resources and facilities in the right places. But we're not necessarily using that to plan individually for each young person. It's the layers underneath which supports in developing the right programme for that young person and ensuring that they're attending the right setting. And those figures are helping us ensure that there is sufficient. There's obviously there's not a bottomless funding pit to be able to deliver absolutely everything that's required, but the figures and our interpretation of the figures do help us to use that funding as efficiently as possible, and we're absolutely reliant on schools and our partnership with schools to do that. In terms of the length of time an EHC plan might last for, statistically we would demonstrate that where a learner gains an EHC plan, that they normally continue to hold that until the end of their education journey. Parents are absolutely, in my experience, keen to see that plan continues once it's been developed. It's unlikely that, for example, if it was a very young learner that seemed to be demonstrating some special educational needs traits, that we would want to make sure that we weren't looking at a developmental delay for which some interventions would enable that young person not to need an EHC plan. We'd work with them at send support rather than to progress to an EHC plan. So, you know, I would like to stand by the fact that EHC plans are awarded as and when needed, in line with the statutory guidance, which is a two-part test. We can discuss that a bit more later if you want to. But we would only issue the EHC plan where the two-part test has been met, and that would indicate that this is going to be something that will need support throughout the educational life of the young person. So yes, once awarded, the likelihood is that they'll continue to get that to identify their support, because we wouldn't give it to them otherwise, or we would look to make other interventions to ensure that, take a few more steps to make sure that the plan is absolutely justified. Costings, yeah. The other thing about the EHC plan, of course, is that they're reviewed annually. So all partners meet to review that, and there's an even stronger level at any transition point where a young person might be moving from one educational provision to another, to ensure that the content of the plan is as accurate as possible. And there are times actually where maybe primary need and secondary need might swap. The young person's developed, grown, hit puberty, sometimes things, you know, impact on that. And the last one, I suppose, in terms of the finances, there is the details of the finances are discussed at Schools Forum, and all FACTS members are welcome to attend Schools Forum to see how the finances that are available to the whole system are allocated and the reasons for them being allocated in that particular way. The school, there just has to be an expectation, and I think this will be re-emphasised in the white paper to come. Not that I've read the white paper yet, because it's not out, but I would expect that it will be highlighted in the white paper that local schools will hold, with support from all partners, the responsibility for delivering the special educational needs of the learners within their catchment, within their local area, and I think we'd all welcome that. The schools themselves would welcome that, but that obviously does sometimes throw some budgetary challenges. The current expectation is that within the school budget, there's a section which is the notional funding, which is allocated to schools, and the expectation is that a school will spend £6,000 on any individual learner to support their special educational needs before progressing to other steps. So that's the support network, financial support network around SEND support. If a learner passes the two-part test and applies for an EHC plan, and that is awarded, then the EHC plan itself comes with a top-up value. There is a range of values for that top-up and is reflective of the needs of the young person and also reflective of the resources of the school. So there might be a school that's well resourced to support a particular learner, and actually they themselves would say, well, we don't need an extensive top-up for that. Whereas if it's a different school in Northumberland where there's only one learner in the whole school with those particular needs, legitimately they'd need more resource in order to support that because they don't have the economies of scale maybe that another school might have. Are there pressures within the SEND system from a financial perspective? Yes, there are. The last schools forum, I'd recommend the reports. It's really, really clear from the last schools forum report about what's happened over time for SEND funding. We are, as a partnership and just as NCC ourselves, really focused on looking at how we can make the funds that are available the most efficient use of them humanly possible.
Thank you. That's been a comprehensive answer. I've got Councillor Hill, and then I've got Councillor Matheson, and then Councillor Green.
Thank you. Just on a point, I've raised this before, and you've touched on it, about the time it takes to diagnose ADHD and autism. So on page 23, you see how you're going to measure yourselves will reduce the time that children and young people wait for an autism or ADHD diagnosis. I was just wondering how and at what point is the start date going to, the clock starts, how you're going to measure it. So when we do hear of, there's when parents have raised concerns to the school and big delays about getting an appointment, obviously that links in with the NHS if they're seeing a GP. So I just wonder if you could just drill down and be really specific about how you're going to reduce that time and how you're going to measure and when the clock starts.
Okay. There are currently a number of measures in place. For example, the health services have national targets, etc., and do have waiting lists, etc., targets to meet and record those against their current targets. I'm not the health professional, so it's very difficult for me to sort of quote them straight off the top of my head. But this is something that our health partners bring with us to the SEND system. We've got, previously we've had a different set of databases and dashboards which demonstrate where there's been progress made, where improvements have come on. At our last meeting with our regional DFE colleagues, they actually noted that, it was a bit of a surprise actually in the conversation because in talking to some parents, I was aware that sometimes, you know, the waiting lists are too long and the lived experience for those families isn't good enough. But actually, DFE were comparing us to other local authorities from a health perspective and actually saying that some of our waiting times were shorter. Now, I don't think anyone in our meeting there was satisfied that they were short enough. And this is exactly why it's highlighted in Priority 3, which is about service delivery, and that the Priority 3 working group with the board supporting them will move on from the current monitoring systems of timescales, etc., and shine a light at where feedback from parents is responded that that's not good enough, to make improvements in the system. We're not at ground zero here, but there is work to do, and I'm expecting a very short period of time we'll have quite a tight structure around the metrics of how we're going to do that, and that will be included in the action plan which goes with that priority group. The other side to it is there's you know, all professionals in the field, and actually quite a lot of parents now, though some families are seeking a diagnosis and following a particular pathway, that doesn't mean that interventions wait until the diagnosis is made, either at SEND support or within the EHC plan, regardless of specific diagnosis, we are listing the needs of the young person and the interventions that need to work with them to support them. We're not waiting for a diagnosis to do that, but I do recognise that sometimes a full diagnosis can be helpful as well.
But you can see there's a clear weakness here capturing the data. There's different organisations, the school, the council, and the health authorities. So I get the feeling that you probably catch, so if somebody can get through to the GP and then they get the appointment and then say, well, they waited 2 months to see the education psychologist, but that's would be difficult to capture when they first raise the issue, concerned about their child maybe have one of these conditions. So I just think it's going to be very much one of those stats where danger really doesn't tell the full picture about the length of time it's taken from parents' first concern, or maybe it's come from to getting that diagnosis. And I know what you're saying about, doesn't mean that we won't do absolutely anything until there's a diagnosis, but sometimes the schools and everything just won't unless there is something and a plan in place.
I do think that the structure around holding to account all parts of the system will be much stronger as this strategy is developed.
And that could be something which comes out of that priority 3,
correct,
which is identifying when the trigger point is.
Yeah.
So, I mean, and just on that point, if a parent wants to apply for an EHCP, what percentage of them are therefore granted?
You
might not know that.
No, I do know some of those figures off the top of my head, so I can tell you a little bit about that. There has been a period of time when Northumberland was quite different to the national average, in that almost all EHCP applications progressed to developing a full EHC plan. That was when slightly lower numbers than are currently being applied for come through. But we were looking at positions where it was sort of 92-93% were progressing through to a full plan. We now get around 800 applications a year. So what I was talking about was maybe when there was 400 applications in the past. But we now get around 800, and about 76-77% progress to a full plan. And that is almost exactly in line with the national average, which you could look at those data statistics and go, oh, you used to do 90s and now you're doing 70s. Does that mean we've strengthened thresholds? We are committed to using the same thresholds, which is the statutory guidance of the 2-part test, and we apply that rigorously. The reason for the difference is that we're probably getting around 1,000 applications a year now, which on the one hand I don't see as a problem, because there's a high degree of early intervention, so on. But some of those ones, there's a higher proportion, there's a higher number of plans each year coming through than historically, but the proportion of turndowns is higher as well. But I think that there's an element of that of maybe, so I was trying to say before for Mr. Hodgson there, that maybe there's some recognition of developmental delay, and that actually this isn't a lifelong learning or disability need being identified, or that the school can meet the needs immediately for that person while they're younger, and maybe in 2 or 3 years when they move to a different educational provision, a plan might be needed at that point. So the schools are very good at keeping this under review, and we always take parental views very strongly as well.
I was just trying to drill down, so I'll come to everyone. I was just trying to drill down on what Georgina's question was there, and unless I'm mistaken, I think it's the point at which a parent can apply. So it's almost, is there a data set for when an application is made to a decision being made whether a plan is appropriate? Because as you've indicated there, around 28% of them are not. So it would be unfair to have that as your only bench measure, because 28% by default will not get a plan. And then is there a trigger point which would say once that threshold has been met, how long it takes to implement those processes in the plan. But that's possibly something which is in more detail for that priority group, which is around health, which would sit very much within your committee. But I think it's a valid question around from an initial application being made to a decision being made. Once a decision's being made, is then how that decision is implemented within a school.
And it's really important that parents have confidence that the speed, because I have heard some parents, the awful thing when this happens, it's almost like, and I know I'm going on about health, but it is all related about, I'm not going to go and try to get a GP's appointment because it's so damn difficult to get a GP. And I've heard people saying, I'm, very sure my son or daughter has autism or so on, but my neighbour had this and they had to wait over a year, so what's the point? That, and so it's really important to have the confidence that it's going to be swift as well.
Yeah, bring in Audrey on that one, yeah.
Thank you, Chair. Councillor Hill, I think it's a really good question, and you've almost asked the question that endorses why we have each of our strategic partners leading those priorities. So if we looked at priority 3, it is the matron from CNTW who will chair that priority 3 around waiting times, health, etc., etc. And it is really important that every part of the system, and in fact, I've noted perhaps we could have had health colleagues sat with us because it is a system strategy that we've talked about today. And so I don't want to say that we can't answer the questions for health. What I can say is, as one of the senior leaders for this, it is important that everybody recognises in the system the different bits of the cogs that need to improve so that it all works together. And that's one of the key cogs, I think, that we are absolutely focused on.
So just as an action on that one, because you do chair health scrutiny, I know Rebecca is your scrutiny officer, so it may well be this is something you want to take forward within a health scrutiny setting to bring in some of the strategic health partners to look at that. But I think it's a valid question. But I'm conscious about time, so I want to move on. I've got... Oh, sorry, David. I do apologise, sorry.
This is a bit of an overview as well as that, but in terms of the timeliness of the EHC plan process, so this is just a part of the system, it's not the whole thing, but a part of it. In terms of timeliness for that, there was a point in time about 18 months ago where timeliness was not good enough in terms of the completion of those plans, and there was a number of reasons for that. Sometimes it might be because a health professional report isn't in, or an educational psychologist report isn't in, and we need that report to formulate the plan. But currently, timeliness is, to be completed within the 20-week timescale, which is the statutory timescale set, I think we're currently sitting at 86% completion within the 20 weeks, which is significantly better than the national average, I would say. It's still not great for the 14% where we're outside of timeliness, but 86% currently for EHC timeliness, and that can only be, I haven't got the details to share with you, that's what that priority group will drill down into, but that must mean that health professional reports, any social care reports, any educational psychologist reports must be coming in relatively good times, otherwise we wouldn't be able to hit the 20 weeks for 86%.
Great. Thank you for that clarification, David. Right, so we've got Councillor Matheson, and we've got Councillor Green and Councillor Spradell, and then we'll move progress.
Well, in fact, a lot of what I was going to ask has actually been already asked, because it was a question about those EHCPs and how long they actually took. But my follow-up to that would be, I think we all have a lot of contact with the parents, and, you know, although I'm interested you call them families, which I think is great. It's more than just parents, isn't it? It's a family thing together, which is great. But also one of those cogs that you mentioned, the moving on from that transition from one school or wherever it might be, from one learning environment to another learning environment, and then notice the passport into adulthood, which I thought was excellent. I'm really very, very happy about that. But we have a lot of contact with the parents, and that transition does seem to be, at least for me, it seems to be a problem. That transition area from one learning place to another. The EHCP seems to. Well, you mentioned that there is that they do have a sort of a sort of handover, but I get a lot of complaints about that handover not being smooth and not being, and them sort of almost starting again. And you mentioned, well, they could start again. I mean, they have, people do develop, young people do develop. That's true. But I think there's a kind of a frustration that the new environment sometimes starts again and almost scraps that EHCP. And that's what I've heard. And it's only what I've heard, that it is being almost ignored and we're going to start again, or we're throwing it out the window and we're starting again with this. And it's just an observation and something that I think is important that, you know, that I also communicate that to you. As far as the schools forum, please, can we know when it is? Can we get details, please? I'm new, so I would like that. I would like to be there. I'd like to be involved. And one thing that one of my other colleagues mentioned to me was, you mentioned the large geographical sort of layout of Northumberland. Indeed, would be very useful to have almost a map of where these resources, the main resources, are available. Where, I mean, I know should be in every school, but the kind of what schools have what, and where, where we can turn to. Yeah, that was it really.
Yeah, I'm happy to bring those back. But just your starting point where you're talking about, you're clearly listening to parents. I think one of the reiterated stronger points of this strategy is exactly that.
Yes.
Is listening to parents, and then getting to a position where we can demonstrate that not only have we listened, but here's the response and the outcome from that, which is something we've not been as good at in the past as hopefully we will be in the future.
You mentioned it was great to hear that you recognise that, yeah.
Right. If I can move on, please, to Councillor Green, and then Spridell will move progress.
Thank you, Mike. You mentioned priority 4 is about getting the children to a provision that's as close to home as possible. I was on holiday, well, I had a wedding to go to in Ellingham earlier this year, and the taxi driver was telling me that he makes his income from transporting a send child from Sea Houses area to Ashington. So this is a journey that takes at least an hour each way. So, and there's a chaperone in the taxi. So I reckon the cost is going to be at least £40,000 a year for sending that child, just transporting the child to the school. Is there any thoughts or calculations to see whether that budget of the taxi fare offered to a local school to provide provision for send would be better value for money and also help you get that priority 4?
There is a significant amount of work in and around school transport globally and specifically for SEND learners. We've got a forensic understanding of each learner and their needs and the associated costs. We use that cost as one of the influences in terms of what provision is offered, and also it impacts on our developments for what inclusive education in Northumberland looks like going forwards. To give you an example, we've developed over the last 3 years with willing and motivated schools 8 specialist support bases. Now, a specialist support base is a specialist provision, so special school-esque provision, but within the mainstream school footprint. To do that, in some places, schools had space, and we were able to develop, redesign, and so on. In some places, we've physically built buildings and so on and so forth, with a view that investment, ideally the investment in the leadership of the school or setting, the investment in the training and the recruitment of the staff to work at those schools, and the physical environment to make sure it's absolutely fit for purpose. In doing so, that will, over time, reduce the costs for transportation for special educational needs learners. But we absolutely have a forensic understanding of where the money's coming and going currently, and also, I think exactly your point was, if that money was invested in a different way at a local school, would we be able to make more efficient use of where we are? We're absolutely all over that, there's more to do. It is a lot of learners and it's a big county. But there's been a number of options put forward.
Thank you, Chair. Councillor Green, really good question. So, committee members who've been here for a little while will recall we've had a number of home to school transport task and finish groups and reviews that we've sort of done some scrutiny work here. Some of that included particularly where we did have chaperones and actually were there opportunities we could do things differently? Was that the most appropriate way? And so we've done a huge amount of work over that. We are about to appoint, I think it's 3 SEND transport officers who will specifically work between the transport team who organise all of the transport and the SEND team who understand the child's needs, and they will do that work and liaison around best value for money, making sure that what we're not doing is having 2 taxis leaving the same place with a child and an escort in each. Is there a different way that we could do that? We also have to consider the infrastructure and whether or not we've got the ability to have a larger vehicle with more children in there and escorts, etc. But to give some assurance and would happily do some work on that. And I do have a suggestion at the end of this item that we might want to think about as a committee.
Thank you. And then I've got... Sorry, did you...
I'll just say, if we did have a provision of some description at more local schools, then this helps people also who haven't actually had the diagnosis confirmed, because there's a provision in the school that they could have an hour a day having this sort of the special education that they need.
Agree, and the specialist support bases, well actually there were primary support bases initially developed. We have a number of those around the county in different schools, and then we're now doing a lot of work around specialist support bases and actually alternative provision facilities. But in that phrase, meeting needs closer to home, is it trips off the tongue very easily, but it's really important, because actually what we're able to do with schools, with wider partners, with families and carers, is ensure young people are kept within the community, so their friendship groups are there. It's not just about the time they're in school, the 39 weeks, it's the other 13 weeks of the year, it's the evenings, it's going to community events, it's weekends, etc. So it's really important, and that's been a core principle for us now for a number of years. Not just about, it is important to look at the financial aspect, but for me it's about the human aspect and ensuring that we're doing the very best for young people and families, putting them first. So back to one of the updated priorities.
Vicky, you wanted to come in as well, didn't you?
Yeah, I just wanted to point out that some of our children and young people who do have SEN are also cared for children, and if actually a child comes into our care and we do have to place them a little bit further away from where the school are, while we are within the court processes, we would be transporting them to maintain that continuity for them as well.
Then I've got Councillor Spidell.
Thank you, Chair. I did note yesterday at Chambers in the portfolio holders report that there had been a saving of £430,000 for home to school transport. So there's obviously big savings there. Some of the points I was going to cover have already been covered, but how do we collate feedback and measure the performance of the SEND strategy and recommend interventions to maintain the focus of the key strategic objectives?
Ultimately, that's the job of the new executive group. Each of the areas and priorities will have action plan with some key priority indicators, so some metrics which go. They're in the design process at the moment. It's not that we're short of them, it's almost that we've got so many metrics actually. It's really identifying which ones that would tell the truth and the real story. It will be the job of the board and then the board itself being held to account by the executive group, who will ensure that where progress is being made, that's clear and transparent, and where progress isn't being made, that we're making interventions to get the progress to where it should be.
Okay. which ties in with how do we continuously measure the performance to ensure success, but with what frequency? How often will that be?
That's one of the challenges within the groups of metrics we've got, in that some might be annual metrics, so education outcomes for GCSEs is an annual outcome, against some others which could be waiting times, which we could be monitoring and updating every 2 to 3 weeks. So there's quite a range. Like I said, I think the trick will be in making sure that the right metrics are selected, which give a true picture and one that's reflected by parents. Because that's the other side to it, is even though sometimes the data tells us we're heading in a particular direction, if the experience of a lot of parents is not that that's not right, and we need to correct and adjust that. And there's a big communications piece, both in listening and explaining what we're doing to try and move forward with that, because it's though the numbers are important, it's actually about the individual and their experience.
Yeah, thanks for that. I was interested to know whether it was a living plan or whether it was just a strategic plan that was launched and then other people owned. Obviously, if it's feeding back in and being reviewed, that's good. Yeah.
So what I'm going to do is I'm going to bring Audrey in, and also she wanted to just do some summary as well before we move on. So Audrey.
Thank you, Chair. Yes, Councillor Spradell. So actually, we routinely review those statistics, and the plan, I always talk about it not being a plan that's on a shelf and dusted off every now and again. That informs the work of the team and the work of the partnership. So I would expect that our health colleagues, for example, are focused on those areas. We've agreed them as a partnership board, and the executive holds them to account. We have to do a number of returns to DFE. We do it in the region for the ADCS network, the Association of Directors of Children's Services, and we get a set of metrics actually across all of our service areas, so in children's social care, in SEND and in education, and we compare across and contrast across the whole region. So we look at performance and challenge each other across the region as well as nationally. David and Vicky spend time also, and we're currently in the development of the new corporate plan for Northumberland. So we will also feed some of those metrics into the key performance indicators. So you will see them peppered across a number of areas. I'm not a fan of having multiple KPIs, otherwise it's a scattergun approach. It's about having them really key focused. And for example, Councillor Jackson, we meet with them every month and go through as a shadow portfolio lead, and we go through some of those statistics. We tell them what's working well. So every single month we're on it. And as David said, routinely, we're looking at those much more frequently. It would be fair to say, I think the team probably never know I'm going to ask the question. So it's not that I'm trying to catch somebody out, because I'm just checking where we are and understanding the focus and where we are more broadly as a team. But that gets reported through in terms of these are the strengths, these are the areas we're focusing on. Actually, we've seen a decline from last month, and that might be in terms of the care proceedings we're going to talk about next. It might be about our annual EHCP reviews. It might be around attendance in schools, etc., etc. And there are a number of indicators that might not be specific within the SEND plan here, but in fact impact, because attendance in schools is directly related to a number of the areas that we're considering. You talked, for example, about SEMH earlier, the social, emotional and mental health. So the volume of our children with a clinical diagnosis around either autism or SEMH has risen over time. We've seen those statistics. That has a direct correlation to some of the attendance statistics that you will hear, for example, in another report that will come across. So hopefully this committee will hear that in a range of ways. I did have a thought, and it's for the committee to think about this. We have a development session in for the committee. I think it's in December. And because SEND, and you will hear it an awful lot in terms of national media, national narrative, David's mentioned. We are awaiting a white paper, but we won't see that till 2026. I wanted to suggest that perhaps we had the development session to have some deep dives into SEND and help you understand some more of the complexities, perhaps look at some of the detail, how we do that measurement, and actually join it with finance. So whilst this committee has an open invitation to be observers at our schools forum, which will make sure that link comes to you, we could do some of the specific details with you in that session and just help to understand that, if that would be helpful. So that's an offer for a theme for the December development session, if you would find that helpful.
I think we would agree with that. So, and Rebecca, if you could send out the date to the schools forum, and that as attendance as observers. So we've been asked to do two things with this report, which is to inform. We definitely have. I think we're all minded to approve it, so that's good. So part of that governance process has been gone through today, and we've categorically highlighted the partnership. And I think as a result of this meeting, it may well be that Councillor Hill, with her chairing of a health scrutiny committee, may actually be taking on some of that priority 3 work around health. So I think we've had a good discussion on this. So thank you very much, members, for that. We'll move on now to the next item on the agenda, which is Care Proceedings and Public Law Outline Annual Report, which is a standing report that we get here at our committee. It's pages 27 to 36. I'll bring Audrey in first, and then I'll let Patrick take the presentation, and Patrick can introduce himself. But Audrey, if you would care to introduce the report for us.
Thank you, Chair. Just very briefly, because Patrick will go into the details. Annually, as Chair has said, this report comes to us particularly focus around our how effective our pre-proceedings and care proceedings are around safeguarding our children, and particularly focusing on permanence. I did just want to highlight a couple of areas. You will see in the report there is a paragraph or two around the pre-birth team. And earlier this week, Vicky, Patrick and I had the pleasure of hosting DFE, and the pleasure of hearing our pre-birth team. We didn't say very much. The pre-birth team spoke to DFE around their work, and the assessment team and our multi-agency safeguarding hub leaders as well were in that session. So really good, and DFE left with a very clear view around how we do things here in Northumberland. So I'll hand over to Patrick, and he will take you through the technicalities of where we are in position.
Make sure the mic's on. Good morning, everyone. I'm Patrick Boyle. I'm a head of service for the social work safeguarding teams. That involves the social work locality teams, which are located throughout Northumberland. Our front door, our MASH, our multi-agency safeguarding hub, the pre-birth team, which Audrey has mentioned, and also the specialist assessment team. And some of those things are mentioned in the report, and I'll say a little bit more about them as well. I also chair our weekly Legal Gateway meeting and monthly legal tracking and permanence tracking meetings. And again, we'll say a little bit more about that within the report as well. I'm hoping that everyone has had the opportunity to read through the report. I think particularly read the feedback from families, from professionals, from court and CAFCAS, which is really, really positive. So I've prepared this presentation to take you through the key points of the report, the service developments, pre and care proceedings, and permanence for children. It is an area of practice that we are particularly proud of. It's a huge strength for Northumberland. I think particularly talking about permanence plans for children and young people. So it is a pleasure to be here to take you through the report. The first thing I wanted to share was really to talk a little bit about our practice model in Northumberland. Our practice model is based on relationships. That's relationships with families, with their extended family members, with the community, with multi-agency partners, with each other as well. And it's the foundation for everything that we do. We do keep children and families at the centre of everything, and I hope that you'll see that throughout the report as well and the presentation. So it's a strength-based relational approach using signs of safety and signs of well-being. It's working collaboratively with families, not doing to families. And it's engaging their wider family and their community as well. And it's important that we do talk about the wider community. It's not just extended family in terms of like grandparents, aunts, uncles. It is who's important to that child within that community, who can support them. And the family is always the starting point for us, particularly when we are looking to enter into pre-proceedings or care proceedings and potentially look to remove that child from their parents or carers. In Northumberland, we have a wide range of services. More recently, we have our Families First partnership linked to the social care reforms, which is looking to transform the social care system. It's bringing together family help and social care and safeguarding together. We have our safeguarding teams, our Stronger Together team, which was formerly Northumberland Family First, which is our Edge of Care team to support and prevent children from coming into care. We have our family group conferencing service, which was launched on the 17th, I think, of September as well. And that is key in terms of supporting our families, working with them to get the right plan for them and hopefully prevent children and young people from coming into the cared for system as well. We have our kinship support team, which has been developed over the last 12 months as well. So we have far more kinship support, and you'll hear a little bit more about kinship support within the presentation as well. But it does place families at the heart of all decision making and embedding that child protection expertise across the whole system, not just in terms of safeguarding, but also in terms of early help and family help as well. For our cared for children, we do have a real strong commitment as corporate parents for our cared for and care experienced children. And we often kind of like ask ourselves, you know, is this good enough for our child or for our niece or nephew or great niece or great nephew if you're a certain age like I am. So it's really important that we do think, is this good enough for our cared for children as well? So in terms of our corporate parent responsibilities, it's really important that we do think about that as well. I think just to mention before moving on as well, we had a celebration event of our cared for and care experienced children in Northumberland and Morpeth a couple of weeks ago. I think quite a few people from the top of the table were at that event. And it was such a proud kind of like moment for us all to see probably about 150, 200 cared for, care experienced children with their foster carers, some of them with their parents and their carers as well, coming together and to celebrate all of their achievements, whether that's educational achievements, whether it's something out of school. It was a wonderful experience. So just wanted to mention that before moving on. So within the report and within the presentation, you'll often hear the word permanence. And, you know, what does that mean? What does that mean for a child or a young person? So I thought I would just take you through this slide as well, because permanence could be a wide range of different options for that child, depending on their age and dependent on their personal circumstances as well. So we often have kinship care with family or friends. They might be subject to special guardianship orders with extended family members or friends. We have early permanence where children are placed from birth into foster carers who are also approved to adopt. So there's a strong emphasis on early permanence, and that's an area that we're doing particularly well on in Northumberland. We have adoption. Adoption is often now looking at family contact as well. It's not what we refer to as closed adoption. We're talking about families who are placed for adoption continuing to have contact with their siblings and anyone else who's important to them as well. We have long-term fostering. Long-term fostering wouldn't generally be a plan that we would endorse for a very young child. It tends to be for much older children. But again, we do have success in terms of achieving a permanence through adoption for children up to the age of 7, 8 or 9 as well. So that upper age range doesn't kind of like preclude them from being adopted. We have return home to the care of parents. That is often an option out of pre-proceedings or care proceedings. Sometimes we will share parent responsibility with the parents. We will have a care order, which means that we do share parent responsibility. But we will be working with that family to make sure that we do discharge that care order and we are not involved unnecessarily with the family. And also long-term residential care as well. That is often an option that's suitable for much older children, but that's never always a permanent plan for children and young people. We would always be looking for either foster care or to return them home to the care of the parents. So I thought that would be helpful just to give you an idea of what permanence might mean for different children, depending on their ages and depending on their circumstances as well. In Northumberland, we have really robust decision-making, strong oversight and tracking. So we have our weekly gateway meeting, which I mentioned earlier on. It's chaired by the head of service, which just happens to be me. So we will consider public outline, which is either pre or care proceedings, the decision for a child to be cared for is always considered as a last resort, always a last resort. Our starting point, as I said earlier, is always with the family and their wider network. It follows through a comprehensive assessment of the child's circumstances, also supported by legal advice, and that final approval for a child to become cared for is always given by the head of service or by a director as well. So there's really kind of like strong, robust management oversight and governance in place as well. We regularly share information with our executive director, Audrey. So Audrey is regularly updated on the number of cared for children and our pre and care proceedings as well. And I also chair monthly legal and permanence tracking meetings with each of the teams to prevent drift and delay for the child. We have really, really strong relationships within the council, but also externally with the judiciary, with CAFCAS. We have strong regional links with other local authorities as well to make sure that we're up to date in terms of our practice. And we have excellent feedback from the courts and CAFCAS, and some of that is noted in the report, and it's also noted in the Ofsted report from 2024 as well, from last year. And we have a very, very dedicated social work teams, working with our family placement team, pre-birth, specialist assessment team, and our legal team, who continue to support families with very positive permanence outcomes for children and young people. So what is public law outline and when is it used? So it's a practice direction under the family procedure rules designed to manage public law cases involving children, such as applications for interim care orders or interim supervision orders. It's a case management system with a timescale of 26 weeks. It's quite an ambitious timescale, but I think it's important for children and young people that we do work towards adhering that timescale to secure permanence for children and young people within that 26-week timescale. And we'll hear a little bit further on how well we are doing within that as well. So it establishes a structured pre-proceedings framework to explore all reasonable alternatives before initiating court proceedings. Family group conferencing, which I've mentioned before, is a key element to support that offer to families as well, providing an opportunity for families to come together and develop their own plans to address the challenges, ensure decisions are made collaboratively and in the best interest of children as well. And as I said earlier, the family, along with their wider community network, is always the starting point for planning and decision making for children and young people, especially when looking at alternative care arrangements. So when is it used? It's used usually when we've been involved with a child for a considerable amount of time. They might have been subject to child in need plans. They might have been subject to child protection plans. And the plan just isn't progressing. There's still ongoing worries. There's still ongoing concerns. Our safety plan that is in place isn't safeguarding, isn't supporting the family. So at that stage, we would have a legal planning meeting and it would come to Legal Gateway for consideration for that pre-proceedings. It acts as a final formal opportunity for families to address the concerns, but also for us to make sure that we're providing the best support to those families to turn things around. It's often referred to as front-loading our assessments to either prevent entering into care proceedings, or when we do enter into care proceedings, we have our assessments completed at that point of issuing care proceedings. I think the important thing around PLO is that parents are entitled to legal advice, and I think parents' entitlement to legal advice often does shift their kind of like engagement, and it's helpful for parents to be supported within those fairly formal meetings by a legal representation as well to hopefully progress the plan. In Northumberland, all children subject to pre-proceedings are reviewed at our Legal Gateway meeting, which they're usually reviewed every 4 to 6 weeks. Depending on the level of concern, we could bring them back to Legal Gateway maybe either a week or two afterwards as well. But all pre-proceedings are reviewed at our Legal Gateway meeting, and we've been doing that for probably about the last 18 months. And I'm kind of like aware from other local authorities that isn't something that happens in every local authority. But for me, it's really helpful that we do track those pre-proceedings. I've lost my space now. It is important that we do track those pre-proceedings to make sure that there's no drift and delay for the child. Now I've lost a slide.
Just keep going.
Is it gone down?
You just added a new slide.
Okay, I've added a new slide. Okay, so what is our picture in terms of public law outline pre-proceedings in Northumberland? So we have 168 children that were subject to pre-proceedings within the last period. It's down from 223 within the last year, so a reduction of 25%. I think what I would say, although there's been a reduction, I think the complexity of some of the children and young people that are coming through definitely have increased, and that's probably reflected in some of the work that Audrey and David have mentioned there as well. The average duration of pre-proceedings has increased slightly to 21 weeks, up from 18 weeks last year. Again, this is often linked to larger sibling groups, multiple assessments, maybe some specialist assessments, and also sometimes availability of people. But it's important that we do, I guess, have that extra period of time to make sure that we get the right decision for the child and the right outcome rather than entering into care proceedings. 76 children progressed to care proceedings, and that's a 45%. It's up slightly from last year. Last year it was 39%. But I think for me, it does show that positive work that's undertaken by the social workers, by multi-agency partners, with the family, the effectiveness of the pre-proceedings to prevent us entering into care proceedings. And it was something that was definitely highlighted as a strength in Ofsted last year. And when you compare ourselves with the regional and national averages, we're benchmarking very, very strong there as well. The regional average is 66, and the national average is 60% as well. So in summary, fewer children are entering pre-proceedings, really strong, effective work with families leading to a reduction in care proceedings being initiated. And I've already mentioned the complexity of the children and young people coming through. So that's our pre-proceedings in Northumberland. In terms of care proceedings and outcomes for children, we have 190 children with subject to care proceedings. That's down from 210, a 10% reduction from the previous year. The national trend shows a 5.6% increase in care proceedings. But I think interestingly, within the last quarter, Northumberland has seen a slight increase, 5% in the number of care proceedings being issued. But this contrasts significantly with CAFCAS, who reported a 40% increase across the region over the same period. So we've experienced 5% over the last quarter. CAFCAS in the region have experienced 40%, so quite a significant difference. We mentioned that 26 weeks a little bit earlier on, so 109, that's 55% have concluded care proceedings within that 26-week timescale. The average duration overall is 28 weeks compared with a national average of 39 weeks. So although we've increased slightly, I think the last time I was here a year ago, I think we were at 25 weeks, which was very, very strong. 28 weeks is still very, very strong and benchmarking very, very favourably against that national average as well. Some children and young people will always go slightly over the 26 weeks. And again, that is often linked to larger sibling groups, complexity, and in fairness, sometimes around the availability of the courts and the judges as well. I think just reflecting, between 2020 and 2023, the average duration exceeded 35 weeks, and it was a peak of 44 weeks in 2021. So we've made significant strides in terms of achieving early permanence for children over the last number of years, and that's certainly something that we want to keep up and maintain. At present, we have 81 sets of care proceedings are ongoing, involving 109 children. So again, in summary, there's been an overall reduction in the number of care proceedings initiated, despite a slight recent increase. And that trend sits along strong performance in achieving permanence for children, which again has been positively acknowledged by the courts, CAFCAS and Ofsted. The next area that we're particularly proud of is children and young people who are exiting or leaving care subject to special guardianship orders, usually with extended family members. So over 30%, almost 80 children are exiting care, going on to live with extended family members under special guardianship orders. This is expected to be the highest in the country for the second consecutive year, which is really, really strong performance. The national average, you'll see, is 11% and the regional average is 21%. So we are well ahead and expected to exceed well over that 30%. So it's certainly an area to celebrate that we're proud of as well. I think in terms of adoption, again, it's another strong area, an area to celebrate. So 13.4% of our children cease to be cared for through adoption by March 2025. That's above the regional average of 11% and the national average of 9%. Our early permanence placements, that's babies being placed with foster carers with a view to adoption, are increasing despite the challenges around adopter sufficiency. We are forecast to exceed 6 placements in 25-26, which again is another strong area of performance. What isn't in the report, which I definitely wanted to include, is 13 children are due to be matched in October and November 2025. 11 will move on to their adoptive homes before Christmas. 2 will move on in January. And it's important to note the age range of some of those children and young people, ranging from 3 months old to 7 years old, and also includes a sibling group as well. So older children are generally more difficult to find adoptive placements for, and also sibling groups as well. But this is an area that we are performing really well on in Northumberland. So I think, just to summarise, it's a great area of work. Very proud of it. As I said at the beginning, we have a very, very stable and dedicated workforce in Northumberland, and I think workforce is coming to fax, I think, in January or February, so it'll be good to get that report. Our staff are always willing to go the extra mile. They're our biggest and strongest asset, and I'm particularly proud of our social work staff and multi-agency partners. We have strong relationships within Northumberland as well, and with multi-agency partners, and that has always been the case. We have really strong relationships with external partners, particularly with the court. We meet with the lead judge, with CAFCAS. We meet with the senior manager in CAFCAS. I know Vicky does as well with the more senior member of CAFCAS. We've got really strong established regional links with other local authorities as well to make sure that we're sharing good practice and that we're learning from other authorities as well. And I think all of this is contributing to really positive outcomes for children and young people, some strong early timely permanence plans. We are benchmarking very favourably against the region but also nationally. So thank you. Thank you, Chair.
And thank you, Patrick. Right. I'll open the floor to questions. Georgina.
Thank you. It is an area of strength in the council, as you've outlined. I just wanted to just ask, sort of interest really, to understand the data. On page 34, you mention Northumberland's seen a reduction in the number of children subject to pre-proceedings and those entering care proceedings. And I just wondered, because and you maybe correct me if I'm wrong, it would seem to me that it's an area where you can't, it wouldn't seem to be too much you can do to prevent that entering care. So, and so maybe correct me if I'm wrong, so I'd just be interested, is it because the birth rate, so there's actually fewer children? Is that the reason for that data? And also be interested to know further down, about the highest rate in the country for special guardianship orders. I'm just sort of speaking as I'm thinking. I was think is that to do with in Northumberland we have more likely to have families living by, but I wouldn't think we would be unique in that. So I'd just be interested to know why that's the case, or why you think that's the case as well.
Yeah, I think the first part, I think it is down to the relationships, the effective work, the intensive work that we do with families to support families to prevent children and young people coming into care. If they do come into care, the family and the extended family are our first starting point in terms of our practice model. But also, we know that it's best for children to stay close to home, close to their education as well. Sometimes it might not be. So I think it is our practice model. I think probably that answer links to the second part as well. We will always look to the extended family, to grandparents, aunts or uncles. Sometimes they are suitable, sometimes they're not. But in terms of us exploring that, there is a rigorous process that goes through that. We do a viability assessment. There are multi-agency checks with a range of agencies, including the police. There is a formal assessment that takes place. So it's not simply placing them with extended family members. We do an assessment to make sure that that is appropriate and that we have the appropriate supports in place for them, family members, to be able to care for that child or those children.
I mean, I think actually that's a stat, because there's some stats you read that ring alarm bells are a bit curious. I think they've been massaged and stuff. But I think those two things show how well they're doing then. Because you would think it is, and it's not just obviously, put it in simple terms, a family done something wrong, or there can be an incident or something that's happened, or death, or so on, or a serious illness. But I think those stats are really, really positive and show. The only other conclusion would be completely neglectful and on, but that with the inspections we've had isn't the case. So I think what you're doing, exemplars for best practice, that other local authorities should pick up, because they're really stark stats, aren't they? I think.
And I think just to add in terms of the kinship support, it is really important that those families are supported. So we do have a kinship support team, which is part of our family placement service. We have increased our kinship support workers over the last probably 6-9 months. So it's important that we support those arrangements to make sure that they don't break down as well. So yeah, that there's strong support around our kinship offer as well.
I'm going to bring Vicky in, then I've got Councillor Green and Councillor Sprittle.
Just to say some of what you're saying there, I've actually picked up doing a regional kinship group as well. So we are meeting bi-monthly at the moment. We're currently doing a piece of work that's scoping out all of the different support offers that is across the region, because they are all different. How things like kinship support is funded and what that looks at. So we are picking up what's the difference across the region, but also looking at how can we get some consistency so families don't get different responses across the areas as well. So, you know, we are in the new year looking at doing a little bit of a peer challenge, so we can challenge each other to see how we can improve. We are sharing best practice in that group, and we're also looking to do a conference as well next year.
Councillor Green.
Thank you, Chair. With the kinship support, just say, for example, you've got a relative who's not got any children and they're working, earning £30,000 a year, and they have to give up that job if they're looking after the child. Would we support them to that £30,000 a year?
So there is a financial assessment that goes alongside SGO's assessments, as well as a support assessment as well, and what that all looks at. So it wouldn't necessarily be no to the £30,000 a year. It would be looking at on a par with foster carer payments for a period of time. We have put forward, though, to be part of the government's pilot in terms of payments as well, but that's been delayed in terms of finding out who has been selected for that. And I think most local authorities will have put forward to say, can we be part of the pilot?
Councillor Spurgeon.
Well, that touches on what I was going to ask or discuss. The pilot scheme for kinship care being upgraded to foster care allowance for families. Will that, it's been put back again, and the Minister said it was for 5,000 children, and I thought that's a rather smaller number, and couldn't see any local authority on its own having less than that in kinship if it's rolled out properly. Do you think that the proposed payment for foster care allowance for kinship carers will increase the number of kinship placements? Is that a barrier to people taking on children?
That's a tough one to answer, because I think here in Northumberland, actually, in terms of the support offer and what we do, is very well received. But if you did go to a different local authority within the North East, it is slightly different. And we know, and I know from the conversations that I'm having within the kinship meetings, that some of the areas within the North East don't have as many people that are converting into kinship carers and securing those SGOs, which is part of the work and part of why the regional DCS group was quite keen that we had this meeting in place, and that we were looking at this area as a region. In regards to the government, I think obviously they've brought out the paper. I think there was probably some feedback to say there's some areas within that and the pilot that they're proposing that could be a little bit flawed. But actually, you know, I think most places were still keen to actually move forward and to test it out. We were anticipating that we would hear by the end of September. I'm being told that this should be any time now, but how long it's put back for, I'm not sure.
Okay, thank you for that. Not seeing any other questions. So you'll indulge me and tell you a little story. Patrick, how long have you been with us as a council?
Since 1994.
Perfect. So Patrick will know exactly what I'm talking about. So one of the first things when the Conservative administration came in 2017, I was deputy leader, had cabinet responsibility for children's services. My first day was pulled into a meeting with the then executive director. She sat me down and I had a whole load of paperwork in front of me. The first thing she said was, the courts hate us. We're not putting paperwork in time. There's things going wrong. We're not widely liked. Since then, there has been a transformation in the service. And I know that staff were working really hard during that time. But what happened was, I think there was a political will to get things done. There was real focus with officers to get things improved. And as you've said through, and as Patrick said all the way through, courts love us now. So what that means is reports are going in. We've got the Social Work Academy. We've got all those changes which have happened within practice, which has meant that things are being done right for the young people. So I am really proud that since 2017, I know some of the changes were happening a little before then, but since then there's been a transformation in the way that our staff feel valued, the way that our staff are working, the support they get, the wraparound care which goes around the work that they do, which is vital. So I just think it's really important to say that this department has been on a journey, and we are seeing the transformation within that department now, which by a mile is leading, I'll say this, we're leading other local authorities in this area, and I know we are an exemplar of really good practice. So I think it's really important to, praise the work which has been done by the team. Every single person has contributed to that transformation, and I'm really happy that the courts love us now, because that actually means that young people are getting the service and the life that they deserve. And for me, the one thing which has stuck for me this morning is the fact that 11 children will have their forever family by Christmas. What better testimony can you have as a job? So please pass that back, Patrick, to the team, that, there's 11 young people, they're going to change their lives, from 3 months to 7 years, and siblings. Wow, fantastic. Vicky.
Yeah, just to add on to that, I think, what myself and Patrick spoke about earlier this week, I think we're down to, in our social work vacancies, down to 3 vacancies now, and we will, by the end of this month, be down to just 2 agency workers who are supporting us, which is phenomenal, because I think probably about this time last year, back in 2025, we had about 18 agency social workers working for us, so yeah, it is.
It's good to have meetings like this. Right, we move on. So thank you very much for that. We've covered that. Patrick, we'll look forward to seeing you again next year, maybe sooner, with some more really good updates on the work done. But please pass on our thanks to staff. We then move on to the reports of the Scrutiny Officer, Forward Plan and Children's Services Overview and Scrutiny Work Programme. Rebecca.
Thank you, Chair. It's just our standard report, so that just to note there's no updates, but just to reiterate that if anyone has anything that they would like to be brought possibly on the work programme, to contact myself or Wayne, and we'll get to look into it.
Great, thank you for that. I don't have any urgent business other than to reiterate we will send the dates out for the schools forum, where you can all attend as observers, and as Audrey's already indicated, the committee development session in December, if we can send that date out as a reminder, and we'll do some really deep dive work into that SEND strategy. So on that basis, thank you very much for your time this morning, and we'll see you at the development session in December. So thank you.